Obamacare and You website tour brought to you by HIVHealthReform.org and the folks at Greater Than AIDS. I want to start with a couple of announcements. Go ahead, Sarah. We just want to make sure everybody knows about the We Can Do It New Basics of Health Reform webinars, which have been Healthcare Reform 101s that are really targeted to case managers and other folks on the front line of the HIV workforce. We have a number of webinars that we've recorded. That's the link you'll see there. There's an overview of the ACA and Marketplaces 101, and two webinars on Medicaid expansion or non-expansion, and we have another webinar coming up in December. And also, we have a webinar on Wednesday, November 20th, which is next Wednesday, that is called Grow Your HIV Organization and Adapt to Health Reform, Emerging Models from Harm Reduction Providers. So there's some really, really cool stuff that harm reduction providers are doing to build health reform or healthcare plans for services and create closer relationships with healthcare providers that the rest of us can really learn a lot from. So please join us for that. Next slide. So we encourage folks to send questions by email or using the chat function. We unfortunately can't take questions live, but we will take questions as we go through the webinar. So just email them to me there. You'll see my email address. And you can also just send them in using the chat feature. Next. And if you're having trouble hearing the webinar audio, you can click on the audio tab and click the Use Telephone little button there, and then you'll see the phone number and access code that you can dial in, and you will be able to hear a lot better than through your computer speakers. Next. Okay, I'm now going to turn things over to our main event today, and we're going to hear from Jen Cates, who's the Vice President of Global Health and HIV Policy with Kaiser Family Foundation, Talia Miller, who's going to walk us through the actual website, and then Jeff Crowley. And there are no slides for the first part of this webinar, but once we turn things over to Talia, we will see slides. So just don't be surprised if you don't see anything. So Jen, take it away.
Great. Thank you so much, John. Hi, everyone. This is Jen Cates from the Kaiser Family Foundation, and I want to very much thank HIV Health Reform for providing us with this opportunity to share this new web portal with this audience, and just generally thank John and all the work that HIV Health Reform is doing to get information out and share with all of us what we all need to know and the learning that we're doing as we're going forward with health reform. So today what we wanted to do from the Kaiser Family Foundation was let you know about a new tool that we developed that will hopefully be helpful to you and if you're serving clients, to clients that you work with, and also to just community-based organizations. But from Kaiser's perspective, and those of you who know us, you probably are very familiar with our policy work. Well, increasingly, once the ACA passed, we got a lot more questions from consumers, and consumers really wanting to understand what the law meant for them. And, of course, since we do so much work focusing on people with HIV, and we know that ACA stands to really affect health coverage and hopefully access to care for people with HIV, we felt that it would be a great step to provide some kind of resource for individuals living with HIV and their advocates to better understand what the ACA meant for them. And so that's what we recently launched, a new web portal that actually takes an individual through the different aspects of the ACA depending upon where they live, what their coverage situation is today, and provides a lot of user-friendly, consumer-oriented materials. And I should say that it was really designed as a consumer site because we felt that there were so many great resources that were being developed for providers, for advocates, for policy audiences, but not as much for the consumer. And that's what this was really trying to do. When you get a chance to look through it, you'll see that it has a lot of links to all those other resources, but it was really for an individual coming and trying to understand what this all meant for them. The content of what you'll see was all developed by the Kaiser Family Foundation policy analysts, and we worked with Jeff Crowley, who's on the phone as well. I'm from Georgetown to develop all the content. It was developed, and Talia will talk about this, as part of our Greater Than AIDS campaign, which is for consumers. And I want to give a shout out to Gilead, who supported the development of the site. So it kind of came together as a collaborative effort. I am going to see if Jeff wants to add anything, but a couple thoughts or things to think about as Talia walks you through. This is really, again, for consumers. So we had to figure out what was the amount of information that an individual coming to a site would want to see and need to see versus how to just get them what they needed and get them to the next step. So we really tried to balance that. And we're also going to be enhancing the site, and we can make changes to it. So that's part of the reason we wanted to get the information out more widely, was to see what folks thought and if there are other things that could be useful, and also just to let people know about it. So with that, I'm going to stop and just see if Jeff Crowley wants to add anything before Talia, who will really take you through the specifics, can start. Jeff?
Thanks, Jen. And I would just say, no, I think you did a good job providing an overview, and I just think that we all hope that this is a really useful tool for consumers. There's so much information, in some cases misinformation out there, and we hope that you find ways to help us get the word out. And if you, as Jen said, have ideas for improvements or additions, we're open to hearing about them. Thank you.
Great. So Talia, who's a colleague of mine in our California office, really was the sort of person who got all the content and made the website come together, and that's she's really an expert at that. So I'm going to let her talk to you a little bit about that and walk you through the site. Talia?
Great, thank you so much, Jen. Just give me 1 second while I pull the site up for everyone. Okay. So what you see on your screen now is the Greater Than AIDS website. It's going to be flipping through a few different promotions that we have going on right now. But as Jen mentioned, Greater Than AIDS is a project that was created by the Kaiser Family Foundation as well as the Black AIDS Institute. It was launched in 2009, and it falls under this area of work that the foundation does for public information and health communication. So it is aimed at consumers. And as you see, we do a variety of targeted campaigns. Greater Than AIDS was created to talk about the epidemic here in the U.S. In particular, Greater Than AIDS targets populations most affected by HIV. So you'll see we have campaigns for women as well as for gay men. We have a testing campaign. And we sort of use these campaigns as tools to surface issues that are particularly relevant to the populations and communities we're trying to reach. So I think the Obamacare and You site is a great addition to what Greater Than AIDS offers. It is the latest of these campaigns, and I think it serves both a need to provide more information on Obamacare itself, but also to connect people who are familiar with the Greater Than AIDS brand with more information about Ryan White and ADAP. And so I think this site really fulfills a few needs for us. So we're going to dive right in. So here is the Obamacare and You hub. I'm going to lead everyone through just a quick tour of all the different features. And just as a little bit of context, when we developed all these different features on this hub, we were really trying to find different ways that a consumer might want to access this information. So some consumers may prefer to look at FAQs. Some consumers really only want to know what is relevant for their particular current insurance situation. Some consumers might want to know what the situation is specifically in their state. So we really wanted to try to find as many access points to this information as possible and make it really simple and clear for people to use the site. So just to begin, I wanted to take you through to this overview page. This is a really helpful document, I think, for anybody who just needs a crash course on what Obamacare, the Affordable Care Act, is and how it affects people who are living with HIV. We kind of consider this as the foundation that we built the rest of the site on. So I would encourage everybody to give this a read. There's also key dates that you'll see along the right-hand side. as well as a set of links that can be useful for both consumers and for their advocates. More information about enrollment, additional resources on the Affordable Care Act, a link to the Kaiser Family Foundation's additional, more general consumer resources, as well as a link to AIDSView and AIDS.gov for finding care and treatment services. So that is our overview page. Moving back to the hub. In this first box on the left, you'll see a set of buttons. This is sort of what we call our scenario feature. So a person can come to this page, and based on their current insurance situation, they can find out what Obamacare means for them. So I'll select Medicaid. And it brings me through to this one-pager where we really wanted to highlight the specific ways that their situation may or may not change. The may not change being just as important for a lot of people to know because I think there are a lot of stresses and concerns about how things might change for specific individuals. And you can always access the different scenarios through this drop-down bar as well. Okay. On the right here, you'll see this common questions that's been rotating through a few different FAQs. We have developed more than 50 FAQs for this particular portal, and they really fall into a few different buckets. There's sort of the basic questions, the really most commonly asked questions that we hear about Obamacare, especially for an HIV-positive audience. Then we broke out Ryan White and ADAP because there is, again, a lot of confusion about how Ryan White fits into this new landscape. And then we also have sections on Medicaid, employer insurance, state marketplaces, again, another area of a lot of interest and also, I think, unfortunately, a lot of misunderstanding as well. And then we have two sections down here to catch some of the really common questions that we get about problems in troubleshooting and also just general definitions on some of these terms that people are seeing float around in the media but may not have ever actually gotten a good sense of what they mean, even something like Medicaid or Medicare. So I'll just quickly move into a few of them to give you a sense of the variety here. Some of these questions are very broad because that's, I think, a lot of the time how a consumer would phrase a question or would think about a question. So we have questions like, what are my options through Obamacare? And the answer for that clearly is a little meatier than some of our other FAQs, and I think just tries to walk people through some of the same information that we would provide on the scenarios, but breaking it out in a different format. And then we have more targeted questions, something like, will I be charged more for insurance because I have HIV? Again, a very commonly asked question, and this is, a very direct answer. We want to be really clear. So this one in particular doesn't have to be as meaty because we have a very clear, direct answer. So there's more than 50, and we really encourage everybody to explore these and use them in whatever ways you think your patients or colleagues could use them best. They're also searchable on the site, so you can always go up into this search box and access the different FAQs that way. Moving back to the hub. As we scroll down, you'll see this map of the United States. Again, this is just another way that people can, another access point for people to find out how Obamacare affects them and their communities. I will select California because that is where I am. A little bit of a formatting issue. So this is an example of our state page. We have broken the state pages down into 4 categories as well: the health insurance marketplace, Medicaid, Medicare, and Ryan White and ADAP. The Ryan White and ADAP section have been of particular interest because I think having all of these resources, state-level links and information about Ryan White and ADAP pulled together in one place has been a really valuable tool on its own for a lot of our folks and our partners. So on each of these state pages, you'll find the name of the marketplace, the link to the marketplace, any any helpline that's available, and also a link to a list of qualified health plans for each of the states. That was another piece of feedback that we were hearing, is that people wanted to know who the players were in their state. Even if they weren't ready to enroll, they just wanted to know kind of the landscape and what was out there. So we added that qualified plans list as well. And each section is expandable. So if someone is looking for more information on one area, they can just click the read more. And then it also links back to FAQs that are related to that particular topic. So that's an example of the state page. Moving down. On our left over here, you'll see the U-Tunes Get Ready for Obamacare. This is a really compelling, fun video created by the Kaiser Family Foundation that has really, I think, caught on and been placed in a lot of media locations, and it's just a great overview for a general audience. It's not specific to HIV, but we think it's just so consumer-friendly that we really wanted to highlight it here. And then in the middle here is a promo for an interactive tool. This is actually the last piece that we're still working on. It is set to launch early next week, so we'll be sure to update everyone when that's live. For now, it's linking to healthcare.gov to lead people through their program of a set of slides that kind of gives people an idea of what they might be eligible for. When our interactive is live, it will be tailored specifically for that HIV-positive audience, and it will walk people through sets of questions and then generate a tailored end slate that gives them a sense of what might be available to them, as well as links to take further action. Over here we have the checklist. This we think is a really important tool because obviously signing up for new insurance or thinking about what is important to you as you seek insurance is a pretty complicated issue, and this checklist really breaks it down and provides a tool for a consumer to think about, okay, do I want to make sure that I can still see the same provider? What medications am I on, and is it important to me that I still be able to use the same pharmacy? And it also just walks people through all the different pieces of information they'll need beforehand so that they can gather that. And I think this tool in particular is one that we really envision community-level organizations being able to take advantage of. So we really encourage that and would love to hear any feedback on that as well. Hub. Under the checklist, we have our new benefits. So this is a page where we just take the 10 essential benefits provided under Obamacare and really highlighted the ones that we felt would be most relevant for an HIV-positive audience, and also just kind of broke them down as to what they really mean on a more personal level. Some of the terms, like ambulatory patient services, I think are not the most intuitive, so we just wanted to make sure to highlight that there are new essential benefits and that they could impact your care and your treatment in a positive way. So we broke those all out here. And I just wanted to note that all of these pages are printable, and we also have a community clinic kit of really easy download and printable documents that I will show you next. So over here on the left, this is our community toolkit. So each of the resources that I've pointed out is listed under here, and this link will lead you to a PDF that has sort of a stripped down resource version of it so that you're not printing out really graphic heavy images or anything like that. This is really just the core information. We wanted to make it as easily and readily available as possible. And then further down on the community toolkit page, you'll see a set of suggested Twitter language, Facebook language, and banners. And this is where we would just really appreciate any involvement by all of the groups that everyone on the call works for. We have created this resource, but the success of it really depends on it reaching consumers, and we would really love any support, any shout-outs that anybody can provide. We would really value that quite a bit. So we've made that as easy as possible. Obviously, feel free to tweak any of the social media language, and the banners are available either as images or as embed code. So we've tried to really break that out and make it as simple as possible. So let me take us quickly back. And the other resource that we have not taken a look at is the glossary. This is, again, really oriented towards consumers, so really simple, quick definitions for a lot of the terms that people are seeing out either in our resources or in the news. And it's broken down by letter and a really easy resource to utilize as well. I think that is everything. I know we would love to hear any questions about the resources or how they were formed. Oh, sorry, I missed one. This is a very crucial one. Down on the right-hand side, you'll see a link to the Kaiser Family Foundation subsidy calculator. This leads people through a set of questions, again, to determine what types of subsidies they might be eligible for. And we've gotten great feedback on this tool. It's been used everywhere, and we would just really encourage people to check that out if you haven't already. And with that, I think we'll probably open the floor to questions.
Great. Thank you so much, Thalia, and Jen and Jeff. So we have a couple of questions that have come in. One of them is, why did you all use Obamacare instead of ACA? Folks noted that Obamacare has some very negative connotations, and we're curious about that word choice.
Yeah, this is Jen. It's a good question, and we've definitely thought a lot about this. So for those of us working on health reform more from a policy and community perspective, we obviously often say Affordable Care Act or health reform. A lot of consumers who, especially in our surveys that we've done, who didn't even understand Affordable Care Act or really didn't have resonance for them, Obamacare was what they related to as what it meant. So we wanted, again, this is very consumer oriented. It certainly is the term that the administration is using. So we just thought that would be a more accessible way to bring people in, but we use both throughout the site. So that is the reason.
Great. I figured it would be a decision informed by research somehow, of course.
Yeah.
And how often do you plan to update the site, for example, with information about, for example, the administration just made some announcements over the past couple of days about individual insurance. Will updates and information like that be reflected in the site?
Very good question. So what we're going to do, and that is one that has that's a great example of one that's just got announced and the details aren't quite available yet, but when there's something that we feel will affect consumers that they need to understand, we would definitely, work that information in the way we've presented it, we will update it. So we have the ability to update as needed. And just as another example, we've already gotten some responses from different states saying, oh, our Ryan White information is a little outdated, can you update it? And we can do that pretty easily. But things like the big change just announced, to the extent that that will have implications, we'll have to go in and make those changes, and we're just waiting to find out what the final decision, all the details are.
Great. Thank you. Any other questions about the website and the content? Please send them in. We don't particularly have the time today to get into detailed ACA questions, but we can certainly respond to those individually after the site, or I'm sorry, after this call. So a question that we received is, how did you all, when developing the site, get information on the marketplaces if the federal websites are not working properly?
An excellent question. So what we did is we relied on, first of all, looked at the state websites where they were available and included all those state-specific information. But for the federal exchange, it's really the only way to get that information, as everyone is probably well aware, is primarily through healthcare.gov. So we're reliant on that resource just like everybody else is. So as more information becomes available there, we'll be able to include it. Now we do have, we were able to use databases to list all of the health plans in the federal marketplace, because there were details on those available. But in terms of people being able to go in and log in, we don't have a separate login or something like that. But I think that's what you're talking about, that we were able to get the information from databases that already exist that list all the health plans. And Talia's showing that on the screen right now.
Exactly. Yeah.
This is Jeff. Could I just jump in on that point? I think it's also important for people to understand that healthcare.gov is operational now. There's aspects of it. There have been challenges, as we all know, and with people actually enrolling. But the bulk of the information that's available, people can access. So people shouldn't get the message that they shouldn't look at healthcare.gov now, because there's still a lot of resources that people can access there.
Yeah.
And if folks are interested in seeing what plans are available in their state, there is a way to do that on healthcare.gov, and you can just kind of browse plans. And there's also, as today's presenters mentioned, the Kaiser calculator, which will give you an idea of what the premium might be in your area, as well as the subsidy that you might receive. It's also important to remember that folks can apply over the phone for the marketplace, and the toll-free number is displayed very prominently on healthcare.gov, and we encourage folks to try that route for enrolling in the marketplace and getting that process started. We've heard that it's working pretty successfully. Well, that looks like the extent of the questions we got today. So we have been very efficient today and done things in just about half an hour. Jen or Jeff or Talia, any closing comments you'd like to make?
This is Jen. I'll just thank everyone for their time, and really this was just an opportunity to walk you through it a little bit more. But please, if you do, as you look through it, if you do have other questions, we'll get back to you. Just send them to us or to John, and we'll make sure to get back to you. And we're really very eager to get suggestions and ideas for making this more accessible and usable for consumers. So thanks for the opportunity.
And Jeff or Talia, anything you'd like to say?
This is Jeff. I would just say thanks again to HIV Health Reform for all its good work and for allowing us to talk about this new resource.
And I would just echo their thanks and say that, again, we would love any additional help that anyone can provide in sort of pushing this resource out to everyone who can benefit most. And if anybody needs anything, any tailored either social media messages or other imagery, they again can feel free to contact me, and I would be happy to help with that.
Great. Well, thank you all so much. We encourage everybody to go to greaterthan.org and browse through the site directly. Again, it's greaterthan.org, and we also encourage you to visit HIVHealthReform.org for all your health reform and HIV needs. Thank you so much, everybody, and have a great rest of the day and a great weekend. Bye-bye.